In this video, we will discuss the muscles forming the pelvic floor, namely levator ani and the coccygeus muscles. This is a 3D model of an articulated pelvis. We can tilt it anteriorly like this. We are looking now a top view to our pelvic floor, and this is the boundaries of the pelvic inlet, and we can see the muscles forming the pelvic floor. This is the left levator ani muscle formed by two major parts, and this is the right levator ani muscle formed also by major two parts, and posteriorly we have the right coccygeus muscle and left coccygeus muscle. Let's see a view from the pelvic outlet. As we see, this is the muscles forming the pelvic floor, but from bottom view. This is the two parts of the left levator ani, and this is the two parts of the right levator ani, and posterior to levator ani we have the left coccygeus muscle and the right coccygeus muscle. Before describing origin and insertion and the distribution of fibers of these muscles, I want to see the side wall of the pelvis. Side wall of the pelvis. Let's see this view. We removed the levator ani and the coccygeus muscles and are looking to the side wall of the pelvis. This is a muscle covering the obturator membrane and the surrounding bones from inside, called obturator internus muscle. Called obturator internus muscle. And this is a white line, is a thickening of the obturator fascia attached from the back of the body of the pubis to the pelvic surface of the ischial spine. We can call it white line or tendinous arch of the obturator internus fascia. Let's see the other side. This is the side wall of the pelvis, as we see. And this muscle is left obturator internus muscle. If we hide it like this, we can see the obturator membrane filling the obturator foramen. And this white line is thickening of the fascia of the obturator internus muscle, which is called the obturator fascia, attached from the back of the body of the pubis to the pelvic surface of the ischial spine. This is called the white line. And if we can see this line extending from back of the body of the pubis to the pelvic surface of the ischial spine, this is the origin of levator ani muscle. So this is the origin of the whole levator ani muscle. Let's see now the distribution of fibers of levator ani muscle. We can go back to the view of the muscles present in place. We can see the origin of levator ani muscle with its two parts. It originates from the back of the body of the pubis and from the white line of the obturator fascia and from the pelvic surface of the ischial spine. So all this is the origin of levator ani muscle at the right side. Let's see the left side. Levator ani muscle originating from back of the body of the pubis, the tendinous arch or the white line of the obturator fascia, and the pelvic surface of the ischial spine. This is regarding the origin of both levator ani on the right side and on the left side. Regarding the insertion, we can see that levator ani is divided into two major parts. This part is called pubo-coccygeus part, and the posterior part is called ilio-coccygeus part. So, the part originating from the back of the body of the pubis and the anterior part of the tendinous arch is called pubo-coccygeus part, and the part originating from the posterior part of the tendinous arch and from the pelvic surface of the ischial spine is called ilio-coccygeus part. Regarding to the pubo-coccygeus part, it's itself divided further into three parts, three types of fibers. The most anterior fibers will pass medially like this, and to pass behind the vagina in females and the urethra surrounded by the prostate in males, to be inserted here in the central tendon of the perineum or the perineal body. And on the other side, the most anterior fibers of pubococcygeus will go medially like this to be inserted here in the perineal body, just anterior to the rectum and anal canal. So this part of muscle is called levator prostate in males and sphincter vaginae in females. This is regarding the most anterior fibers of the pubococcygeus part of the levator ani. Regarding to the intermediate fibers of the pubococcygeus part of the levator ani, will go medially like this and meet its fellow from the other side to make a complete sling, U-shaped sling behind the anorectal junction. This part of fibers is called puborectalis muscle. Puborectalis muscle. And regarding the most posterior fibers of the pubococcygeus part of the levator ani, will pass medially like this to be inserted into the side of the coccyx and into this raphe, which is called anococcygeal raphe. Anococcygeal raphe. And this part, which is the most posterior part of the pubococcygeus part of the levator ani, we can call it the pubococcygeus proper. The pubococcygeus proper. So these were the three parts of the pubococcygeus part of the levator ani. So we have some fibers will pass behind the urethra in male or vagina in female to be inserted into the perineal body. It will be called in male levator prostate, and in female will be called sphincter vaginae. And the intermediate fibers of this part will go behind the anorectal junction to form complete U-shaped sling with its fellow of the other side. We will call it puborectalis muscle. And the posterior part of the pubococcygeus will be called the pubococcygeus proper, and it will be attached to the side of the coccyx and the anococcygeal raphe, which is a fibrous band extending from the tip of the coccyx to the anorectal junction. And now we can see the other part of the levator ani muscle, which is called iliococcygeus. Let's remember the origin. It originates from the posterior part of the tendinous arch, or the white line of the obturator internus fascia, and from the pelvic surface of the ischial spine. It will go medially, inferior to the pubococcygeus part, to be inserted into the side wall of the coccyx and anococcygeal raphe. So this marked part is only the iliococcygeus part of the levator ani, and this part is the pubococcygeus part of the levator ani. And now we are marking the whole levator ani on both sides. This is the pubococcygeus part of the left levator ani, and this is the pubococcygeus part of the right levator ani, and this is the iliococcygeus part of right and left levator ani muscles. Now we can go posteriorly to look for the coccygeus muscle. As we see, coccygeus muscle, regarding its origin, we can rotate the pelvis like this. It originates from the pelvic surface of the tip of the ischial spine, and it will pass medially like this to be inserted in the last piece of sacrum and the side of the coccyx, and its name will be coccygeus muscle. So this is the left coccygeus muscle, and this is the right coccygeus muscle. Let's see the origin on the right side, the pelvic surface of the tip of the ischial spine, and the muscle will pass medially to be inserted into the last piece of sacrum and the side of the coccyx. What about this ligament? Yes, it is the sacrospinous ligament extending from the side of the lower part of the sacrum and the upper part of the coccyx to the ischial spine tip, to the tip of the ischial spine. So it's considered as the posterior rudimentary part of the coccygeus muscle. And now we finished the origin and insertion of the muscles forming the pelvic floor, namely the levator ani and the coccygeus, and we can look for the last time from our pelvic outlet on the distribution of these muscles forming the pelvic floor. This is the pubococcygeus part and iliococcygeus part of the left levator ani, meeting its fellow on the other side, the pubococcygeal part and iliococcygeal part of the right levator ani, and posterior to it we have left coccygeus muscle and right coccygeus muscle. And now these muscles forming a diaphragm separating pelvic organs above it from perineal organs below it. Thank you for listening and goodbye to other videos.